and welcome. My name is Dr. Bryant Snyder, and I am the owner and clinical director of Chronic Care of Richmond and Weight Loss RVA. I've been in private practice in Richmond for over 20 years. I'm a board certified chiropractic physician, certified in functional and integrative medicine, and I've completely integrated my office into what we call an integrative medical clinic. We actually have our nurse practitioner who's our medical director. Her name is Abby Rickle, and so she oversees our regenerative medicine department. The reasons why we want to discuss what is chronic joint pain as well as why do you have it is because most patients that come in here have what you're dealing with. So why are you here? So when we talk about why are you here, we want to really understand if you're suffering from a chronic or arthritic joint pain, or you're just trying to avoid surgery, or you're just tired of taking medications and masking your symptoms, or if you're frustrated with your current treatments, maybe you've already taken medications or currently taking medications, you've already gone to physical therapy, you've already had surgery, or you've already had all these things and you're still suffering. So we're looking to help improve the quality of your life for a non-drug, non-surgical approach to be able to help fix the problems, and wanting to learn more about options that we have at this clinic. So knowledge is power, and knowledge is key to success and with the types of different programs that we have. So we do a lot of education for our patients because it's very important for them to understand what's happening. So Time did an article about this, which is a fantastic article. It talks about the secret killer. And the secret killer, the primary secret killer is inflammation. So inflammation is what leads to all of this degeneration and all this breakdown. So degeneration is the deterioration and loss of function in the cells of a tissue or an organ. So that inflammation is the primary cause of what causes that. And when we talk about degeneration, I'm sure you've heard of degenerative disc disease. I'm sure you've heard of bulging discs and herniated disc and stenosis and osteoarthritis. All of that is degeneration. That's what ultimately why people come in to see us. So degeneration is what causes the joint pain, right? So inflammation leads to the degeneration, and then that leads to pain. So we see lots of patients that come in to have whether neck pain, back pain, in between the shoulder pain. Could be, again, degenerative disc disease, osteoarthritis, stenosis. It could be hip issues, could be loss of cartilage in the hip, could be some type of torn soft tissue such as labrum in the hip or even in the shoulder. Could be osteoarthritis in the hands or in the foot. Could be we see tons of knees that you could have an old injury. It could be that you've had some type of meniscus tear, or you've had some type of ligament issue or soft tissue loss of cartilage. All of those things we're able to help. So what allows that inflammation and degeneration to get out of control to begin with? Well, it depends on there's lots of stress what patients are dealing with. I'm sure you don't have any stress, right? No, everybody has stress. So increasing levels of stress and strain on the body, which leads to all this breakdown and degeneration and also inflammation. So diet is a big one. So the standard American diet, it's SAD for short, which is sad in the United States. We're eating a lot of sugar, and we're eating a lot of fast food and all of this processed foods. All of these things turn into inflammation, turn into sugar, and then it flares everything up in your body. It could be your lifestyle. It could be not getting proper sleep. It could be emotional stresses that you're dealing with. It could be physical stresses. It could be chemical stresses. Chemical stresses lead to toxins, and it could be toxins, which are a lot in the type of foods that you may be eating. It all could be the medications. We see a lot of patients that are coming in, they're taking 5, 10, 15, 20 medications every day. Just that by itself, that's a lot of chemicals. It could be some type of physical injury, some type of trauma, fall, could be a car accident, could be sports related back when you're a kid, or lack of physical activity because your knees are so bad, or your hip is so bad, or your back is so bad. So this is why you have all this chronic joint pain. So how does that chronic pain affect our lives? Well, you're going to have less range of motion. You're not going to be able to get up and move around the way that you should. It limits your mobility. It causes depression, anxiety. You get depressed if you can't go do the things. You're just stuck at the house, and you can't go hang out with your friends or your family, or go to vacations, whatever it may be. It could be decreases in social life. It limits your ability to actually work. It creates mood swings. It promotes long-term chronic disease over time. And affects the brain and decreasing. So your neurons in your brain start to break down. Then learning and attention and memory and thought processing and motor control and coordination all starts to break down because of that. So at this office, at this clinic, is an integrative clinic. And what that means is we have lots of different pieces of a puzzle to actually help the patient. So we have options for regenerative medicine products. We have also regenerative products such as platelet-rich plasma or PRP. We actually get it from your own blood. Has some incredible opportunities for healing. Trigger point injections. We have chiropractic services. We have non-surgical spinal decompression services. We have class 4 laser. We have pulse electromagnetic field therapy. We've got a lot of things that we can put together for a patient to heal without drugs and without surgery. So thank you for being here at Chronic Care of Richmond. We offer responsible pain management. We don't want you to mask your problems or your issues. We want to actually fix them. Next is when we're going to determine if we can help you, and we're going to give you some options to help improve the quality of your life.